Now next part, again you can see what are the different targets. Okay, what are the different targets? So how you can decrease the sympathetic outflow. So sympathetic outflow is mostly responsible for the increase in the blood pressure. So how can you decrease the sympathetic outflow? What are the different targets? Okay. जैसे ही ब्लड प्रेशर कम होता है बैरोरेसिप्टर विल सिग्नल द ब्रेन. ओके, बैरोरेसिप्टर क्या करेंगे, ब्रेन को सिग्नल करेंगे ब्लड प्रेशर कम हो चुका है, भाईजान कुछ तो भी करो. तो भाईजान क्या करेंगे, सिंपैथेटिक आउटफ्लो बढ़ाएंगे. सिंपैथेटिक आउटफ्लो बढ़ाएंगे तो सिंपैथेटिक आउटफ्लो बढ़ा, ठीक है, बढ़ाते हैं तो कैसे बढ़ाएंगे. So there will be increase the synthesis of your noradrenaline. So noradrenaline is synthesized from tyrosine. Tyrosine will be converted into dopamine. Tyrosine will be converted to dopa. Dopa will be converted to dopamine. Dopamine will be converted to noradrenaline. It will be stored in the synaptic vesicle and it will be released upon stimulus. Now, there is one drug known as a metyrosine. There is one drug known as a metyrosine. Metyrosine. So this will block the uptake of tyrosine. Tyrosine का uptake बंद कर देगा. So there will be no production of dopamine, then noradrenaline. Then again, so after the, if you cannot stop this, tyrosine will be converted to dopa will be converted to dopamine, and dopamine will be stored in the synaptic vesicle and will be converted to noradrenaline. So you can deplete, okay, you can deplete the these catecholamines. You can remove this catecholamine from their storage site. It is done by reserpine. Reserpine is known as a catecholamine depleters. Reserpine is known as a catecholamine depleters. याद रखो इसको. So it will prevent the storage of dopamine into vesicles. Dopamine से बाद में noradrenaline बनता है. Again, so if you cannot prevent this, so this noradrenaline will be released. It will be released. You can block this release of noradrenaline by using ganglionic blocker known as guanethidine. Suppose you cannot stop this if noradrenaline is released finally in the synaptic vesicle. Now noradrenaline will act on its receptor present on the postsynaptic neuron, that is alpha and beta. So you can prevent this by, you can prevent the interaction of noradrenaline with the alpha receptor by using prazosin or selective alpha blocker. You can also prevent the interaction of noradrenaline on the effector cell by using beta blockers. Then again, so whatever the release of noradrenaline is there, तो ये जो रिलीज हो रहा है नॉर एड्रेनलिन का, that is regulated by negative feedback mechanism and it is regulated by central alpha 2 receptor. So whatever noradrenaline is being released, so that release is regulated by this receptor known as a central alpha 2 receptor. So presynaptic central alpha 2 receptor will regulate the release of noradrenaline by negative feedback mechanism. So you can prevent this release by using central alpha 2 agonist, that is nothing but the methyl dopa and clonidine. मैंने पैसे जैसे बोला है आपको. So you can block different steps. You can block first step, that is conversion of tyrosine into dopamine by using metyrosine. If you cannot prevent this, dopamine will be dopa will be uh, dopa will be synthesized. After that, dopamine will be synthesized. Dopamine will be stored in the synaptic vesicle. Synaptic vesicle. So this can be prevented by this reserpine. So reserpine is known as a catecholamine depleters. वो deplete कर देगा, वहाँ से आकर लेगा. Now dopamine will be converted to noradrenaline. Noradrenaline will be released, and release of noradrenaline is prevented by this ganglionic blocker known as a guanethidine. Once noradrenaline is released, it will act on a postsynaptic neuron, or it will act on its effector cell. Okay? It will interact with the effector cell, the receptor present on the effector cell. That is nothing but the alpha and beta. So you can prevent this interaction by using selective alpha blockers like prazosin, terazosin, doxorubicin, and you can also prevent this by interacting with the beta receptor by using beta blockers, metoprolol, atenolol, propranolol. You can block the ganglionic blockers. Example, trimethoprim and hexamethylene. They will also block the release of this sympathetic. They will also decrease the sympathetic outflow by blocking the sympathetic ganglia, and they are known as a ganglionic blocker. and other drugs. These are known as adrenergic neuron blockers. This is the target how you can decrease the sympathetic outflow. Now, centrally acting drugs, those anti-hypertensive drugs which act its central mechanism, centrally acting drugs. So first one is known as a clonidine. First one is known as a clonidine. So it is a potent anti-hypertensive drug. It is a imidazole derivative. याद रखो. Clonidine is nothing but the imidazole derivative. It acts as an agonist to central alpha 2 receptor. It acts as an agonist to alpha 2 presynaptic adrenergic receptor. Activation of this receptor decreases the release of noradrenaline, which leads to decreasing the blood pressure and also decreases the plasma renin. ठीक है, तो सेंट्रल अल्फा टू एगोनिस्ट है ये. तो प्री साइनेप्टिक जो अल्फा टू रिसेप्टर है उसको स्टिमुलेट करेगा ये क्लोनिडीन जो इमिडाजोल डेरिवेटिव है. And because of that stimulation there is a decrease of release of noradrenaline and decreases the renin activity. So that is a clonidine. Now another drug is there known as a guanfacine. Guanfacine. Guanfacine has a similar action to clonidine. Only duration of action is long. Guanfacine जो है वो longer acting है. So adverse reaction क्या है इन दोनों के देखो. Dryness of mouth. Okay, dryness of mouth, vertigo, thyroid pain, constipation, impotence in the males, GIT disturbances, rebound rise in the blood pressure. Sudden stoppage of treatment leads to rebound blood pressure. तो अचानक से अगर क्लोनिडीन का थेरेपी बंद किया तो इससे ब्लड प्रेशर बढ़ता है. तो रिबाउंड ब्लड प्रेशर. उनका यूज क्या है? व्हाट इज थेरेपेटिक यूज? सो इट इज यूज्ड इन द हाइपरटेंशन अलोंग विद द डाययूरेटिक्स. डाययूरेटिक्स ड्रग जो है उनके साथ में ये हाइपरटेंशन में यूज करते हैं. So used to treat the hypertension of menopausal and hot flushes. Menopausal and hot. So जो pregnancy में hypertension होता है that is known as a menopausal hypertension. And remember it is the drug of choice in the treatment of hypertension in the pregnancy. यहाँ पे लिखा नहीं है मैंने I think, but it is a drug of choice in the pregnancy. Clonidine and methyl dopa. Methyl dopa particularly drug of choice है. So याद रखो इसको. Central agonist जो है they are the drug of choice in the treatment of hypertension in the pregnancy. It is also used to control the symptoms of opiate and alcohol and nicotine withdrawal. It is also used in the diagnosis of growth hormone deficiency. ये याद रखो. What is the use of clonidine? इसके ऊपर क्वेश्चन आ सकता है. क्लोनिडीन का यूज क्या है? याद रखो इसको. So used in the combination of diuretics to treat the hypertension in the menopause plus hot plus. It is used in the treatment of withdrawal of alcohol, opiate, then nicotine dependence, used for diagnosis of growth hormone deficiency. Now another drug is known as a central alpha 2 agonist known as a methyl dopa. Alpha methyl dopa. Alpha methyl dopa. It is a prodrug. It is a prodrug converted into active metabolite. Okay. It is an isomer of methyl dopa and it has a structural similarity like dopa. Okay. Dihydroxyphenylalanine. Dopa मतलब क्या है? Dihydroxyphenylalanine. Okay. So alpha methyl dopa has a isomer of methyl dopa and has a structural similarity with the dihydroxyphenylalanine. It is metabolized to alpha methyl noradrenaline. तो देखो यहाँ पे एक्टिव मेटाबोलाइट कौन है इसका? एक्टिव मेटाबोलाइट कौन है यहाँ पे? मिथाइल नोराड्रेनालिन. So alpha 2 methyl noradrenaline in the neurons, which acts as a it acts as a activating the alpha 2 receptors in the vasomotor center, which inhibit the renin, also inhibit the renin in the kidney. तो मैकेनिज्म क्या है इसका? याद रखो. So this alpha methyl dopa is a prodrug. It is an isomer of methyl dopa and it is converted into active metabolite known as a alpha 2 methyl noradrenaline. So it is converted into methyl noradrenaline and in the neurons, and this methyl noradrenaline will inhibit the which will stimulate the central alpha 2 receptor and will decrease the sympathetic outflow and will also inhibit the renin release in the kidney. अगर नॉरएड्रेनालिन का रिलीज कम होगा तो ऑब्वियसली ब्लड प्रेशर कम होगा. रेनिन का रिलीज अगर कम होगा तो ब्लड प्रेशर आगे. सो दैट्स हाउ इट वर्क्स. नाउ इट प्रोड्यूसेस hypertension after period of 3 to 6 hour reduction in the cardiac output and total peripheral rest. Now what are the adverse reaction? Sedation, headache, fatigue, CNS. Okay, sedation, headache, fatigue. Then what are the CNS adverse effects? CNS adverse effect like diminished intellectual drive, drowsiness, forgetfulness, भूल जाओगे आप, nightmares, रात को बुरे बुरे सपने आएंगे, हाइपर प्रोलैक्टिनिमिया मतलब प्रोलैक्टिन लेवल बढ़ जाएगा बॉडी का, गायनेकोमेस्टिया मतलब लेडीज के सिम्टम, जेंट्स में मेंटल डिप्रेशन, पार्किंसोनिज्म, जीआई अपसेट, कॉन्स्टिपेशन, फेलियर टू इजैकुलेशन मतलब ये मालूम होगा, फेलियर टू इजैकुलेशन, देन आर्थ्रालजिया एंड स्किन रैश, these are the adverse effects. Tolerance to pharmacological action can produce, tolerance to pharmacological actions means tolerance develop हो जाएगा इसको, मतलब इनिशियली आपका ब्लड प्रेशर लो करेगा, बाद में नहीं करेगा, टॉलरेंस हो जाएगा. Then it can also produce a fever accompanied by alteration in the liver function test. It may produce cholestatic jaundice. It may occur. Cholestatic jaundice may produce. It produces positive direct antibody test. That is a comp test. It produces positive direct antibody test. Comp test. ये क्या होता है बाद में पढ़ लेंगे. So this is the alpha 2 agonist methyl dopa. And remember, drug of choice in the pregnancy, that is a methyl dopa, alpha methyl dopa, central alpha 2 agonist. They are nothing but the drug of choice in the pregnancy. Again, you can see the mechanism of action of alpha methyl dopa. Alpha methyl dopa, ये होगा. It will decrease the, it will be converted into metabolite known as a methyl noradrenaline. Because this alpha methyl dopa is a product, it will be converted into active metabolite known as a methyl noradrenaline, which will stimulate the central alpha 2 receptor. What will stimulate the alpha 2 receptor present in the vasomotor center. This decreases the sympathetic drive, or this decreases the sympathetic outflow because of the negative feedback mechanism. Alpha 2 regulates the release of noradrenaline by a negative feedback mechanism at the receptor, okay, at the nerve ending. Now if there is a decrease in the sympathetic outflow, or if there is a decrease in the noradrenaline, what will happen? Decreased noradrenaline or sympathetic outflow will cause, will 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 prevent from vasoconstriction. That means will cause vasodilation, which will decrease the peripheral resistance, okay. And another hand, it will decrease the heart rate and force of conduction. जो नॉर एड्रेनलिन रिलीज होता है वो अल्फा रिसेप्टर के ऊपर जाके एक्ट होता है, वैसोकंस्ट्रिक्शन करता है, पेरिफेरल रेजिस्टेंस बढ़ता है. वो बीटा 1 रिसेप्टर के ऊपर जाके एक्ट होता है हार्ट में, फोर्स ऑफ कंट्रैक्शन बढ़ता है, वहाँ पे रेट ऑफ कंट्रैक्शन, हार्ट रेट भी बढ़ता है. तो अभी ये क्या कर रहा है मिथाइल डोपा, ये नॉर एड्रेनलिन को रिलीज नहीं होने दे रहा है. तो ऑब्वियसली क्या नहीं होने देगा, वैसोकंस्ट्रिक्शन नहीं होने देगा. मतलब क्या होगा, वैसोडाइलेशन. दैट मींस डिक्रीज इन द पेरिफेरल रेजिस्टेंस. हार्ट रेट इंक्रीज नहीं होने देगा, फोर्स ऑफ कंट्रैक्शन इंक्रीज नहीं होने देगा. मतलब क्या, it will ultimately decreases the cardiac output. And you know that blood pressure is nothing but the peripheral resistance into cardiac output. If cardiac output is decreased, peripheral resistance is decreased, obviously blood pressure will. That's how this methyl dopa will act. Clonidine will also act in a similar way. Clonidine का सिर्फ active metabolite नहीं होता है, बाकी सब same है. और next one is a moxonidine and relmetin. Moxonidine and relmetinidine. These are known as selective imidazole receptor agonist. Selective, selective cerebral imidazole receptor agonist, that is I receptor agonist. It reduces the sympathetic drive, that is sympathetic outflow, and peripheral vascular resistance. Has a less adverse effect than methyl dopa and clonidine. Now next one is a ganglionic blockers. Ganglionic blockers. So hexamethonium. Hexamethonium blocks the cholinergic impulse transmission, not conductance of the impulse in autonomic ganglia, and this blockage results in the reduction of amount of noradrenaline released from nervous ending, and that decreases the blood pressure. तो ganglionic blocker कौन है? hexamethonium. क्वेश्चन इसके ऊपर आता है, वन ऑफ द फॉलोइंग इज ganglionic blocker. Drug of choice in the pregnancy. Drug of choice in the treatment of hypertension in the pregnancy. अल्फा मिथाइल डोपा. 3 बार बोल चुका हूँ अभी, क्योंकि यहाँ पे लिखा नहीं है इसलिए, ठीक है. तो याद रखो, आप जितना हो चाहे जितना चाहिए उतना लिख भी सकते हो. यू कैन राइट डाउन. नाउ दिस हेक्सामेथोनियम इज नोन एज अ गैंग्लियोनिक ब्लॉकर. इट विल ब्लॉक द कोलिनर्जिक इम्पल्स ट्रांसमिशन, बिकॉज प्री गैंग्लियोनिक नर्व क्या होता है, देखो सिंपैथेटिक नर्वस सिस्टम में भी प्री गैंग्लियोनिक नर्व क्या होता है, प्री गैंग्लियोनिक न्यूरोट्रांसमीटर क्या होता है, एसिटिलकोलिन. पोस्ट गैंग्लियोनिक न्यूरोट्रांसमीटर क्या होता है, नॉरएड्रेनल. सिंपैथेटिक में क्या होता है, ये होता है. और पैरासिम्पैथेटिक में क्या होता है कि दोनों प्री एज वेल एज पोस्ट गैंग्लियोनिक न्यूरोट्रांसमीटर्स एसिटिलकोलिन. सिंपैथेटिक में प्री गैंग्लियोनिक एसिटिलकोलिन होता है, पोस्ट गैंग्लियोनिक नॉरएड्रेनल होता है. और पैरासिम्पैथेटिक में दोनों में भी एसिटिलकोलिन होता है. ये याद रखो. दैट्स व्हाई गैंग्लियोनिक ब्लॉकर्स. Hexamethonium block the cholinergic impulse transmission, not conductance, and in the autonomic ganglia, and this blockage result in the reduction of noradrenaline release in the noradrenaline release from the neurotransmitter, and this decreases the blood pressure. Nowadays these drugs are not used because they have high incidence of adverse effect. Another drug is there known as a trimethoprim. Trimethoprim camphor sulfonate, because of extremely transient action, it is also used by intravenous. Transient action मतलब ये बहुत ही short duration of action होता है उसका trimethoprim का. So trimethoprim is a very short duration of action. So it is used in the form of intravenous injection. So it is a drug of choice in the treatment of dissection of aorta. It is a drug of choice in the treatment of dissection. aorta का कोई सर्जरी है तो उसमें ये ड्रग काम आएगा, क्योंकि अगर सर्जरी किया तो वहाँ पे ब्लड प्रेशर बढ़ जाएगा. Mecamylamine is another drug. Mecamylamine is another ganglionic blocker used for the smoking cessation. जो आप स्मोकिंग करते हो उसके लिए ये ड्रग यूज करते हैं. स्मोकिंग सेशन के लिए कौन सा यूज करते हैं, याद रखो इसको. Mecamylamine is a drug used in the treatment of smoking cessation. क्वेश्चन आ सकता है इसके ऊपर. नेक्स्ट कैटेगरी इज adrenergic neuron blocker. Adrenergic neuron blocker example is guanethidine. So it is selectively taken up by nerves and act on a post-ganglionic sympathetic neuron. It inhibits the release. It inhibits the ability of nerve impulse to release the noradrenaline, and also block the reuptake of noradrenaline and depletes the noradrenaline from storage site. That is the mechanism of action. Now, guanethidine abolition means guanethidine stops the protective cardiovascular CVS reflexes mediated by carotid baroreceptor and adrenergic system, and result in the severe postural hypertension. Postural hypertension. तो ये एडवर्स इफेक्ट है उसका. क्वानिटिडीन कैन रिजल्ट इन द पोस्चरल हाइपोटेंशन. एडवर्स ड्रग रिएक्शन क्या है, पोस्चरल हाइपोटेंशन. पोस्चरल हाइपोटेंशन मतलब ये आप मैं बोलता हूँ. पोस्चरल हाइपोटेंशन मतलब क्या है, जैसे मैं आपको सामने बैठ के पढ़ा रहा हूँ आपको, अगर मैं खड़ा हो गया तो मुझे सडनली हाइपोटेंशन हो जाएगा. अगर मैं बैठा हूँ तो अभी मेरा ब्लड प्रेशर नॉर्मल है, अगर मैं लेट जाऊंगा तो सडनली मेरा ब्लड प्रेशर कम हो जाएगा. सो डिक्रीज इन द ब्लड प्रेशर बाय चेंजिंग द पोजिशन नोन एज अ पोस्चरल हाइपोटेंशन. अगर पोजिशन चेंज करेंगे आपका तो ब्लड प्रेशर कम हो जाएगा, उसको बोलते हैं पोस्चरल हाइपोटेंशन. So this guanethidine has a adverse effect of postural hypotension. So what are the adverse reaction? Adverse drug reaction, postural hypotension, then biliard chocolate diarrhea. Biliard chocolate diarrhea मतलब क्या, बिलरुबिन जो है वो बिलरुबिन एक्सेसिव आपके स्टूल्स में आ जाएगा. नोन एज अ बिलियर्ड चॉकलेट डायरिया, मतलब स्टूल्स आपके चॉकलेट कलर के हो जाएंगे. पैराटॉइड पेन, fluid retention. Okay, these are the adverse effect. Then another drugs are there. Okay, there are similar drugs like that, guanethidine. Which are these? Pethidine and debrisopine. These are the similar drug like guanethidine, but they are no more used. They are obsolete. Now next is a catecholamine depleter, reserpine. So it is a alkaloid often from Rauwolfia serpentina. This reserpine. It is alkaloid often from Rauwolfia serpentina, and it causes depletion of biogenic amines like adrenaline, noradrenaline, dopamine from their storage site, centrally as well as peripherally. Acts centrally as well as peripherally. Reserpine binds to the this synaptic vesicle both at central and peripheral adrenergic neuron and depletes it. That's why. And this binding of this reserpine with vesicles is for a long time, and both granular uptake and storage of catecholamine is affected. That's why if there is no storage of catecholamine, there will be not available. स्टोरेज ही नहीं होगा उनका तो वो अवेलेबल नहीं होएंगे किसके लिए, रिलीज के लिए. So that's how it will act. It is known as catecholamine depleters. Catecholamine depleters. What are the pharmacological actions of this reserpine? So reserpine, it is alkaloid. Remember, it is alkaloid obtained from Rauwolfia serpentina family Apocynaceae. So this is known as a anti-hypertensive drug. It is known as a पगले की दवा. So this reserpine is used in the psychosis also. It is also used in the hypertension. So pharmacological actions क्या है इसके? It causes hypotension, bradycardia, decrease in the peripheral resistance, reduction in the cardiac output. It also has antipsychotic action due to depletion of catecholamine. It increases the gastric acid secretion and serotonin, and augmentation of peristalsis. Means it will increase the peristalsis, it will increase the gastric acid secretion. Now adverse drug reaction क्या है? Excessive salivation, cutaneous vasodilation, nasal congestion, increases the peristalsis, acidity due to parasympathetic predominance, orthostatic hypotension, mental depression, weight gain, Okay, Parkinsonism, endocrine disturbances, hypotension, and death during the induction of anesthesia due to deficiency of serotonin in severe depression and suicidal tendency with reserpine. So, if you use reserpine in the treatment of psychosis, it can induce the suicidal tendency. Suicidal tendency है इसको, okay? याद रखो. Now next drug is nothing but the, you can see what again mechanism of action of reserpine. Reserpine, it will cause depletion of catecholamine. It will inhibit the storage of biogenic amines in the neurons. Biogenic amines कौन से? Noradrenaline, okay, noradrenaline, pyrrolidine, and dopamine. So all these are, this storage is inhibited. They are not stored in the scientific vesicle because of this reserpine. And अगर इसका storage नहीं होगा तो release नहीं होगा. So because of that, it causes the vasodilation. Vasodilation result in the decrease in the peripheral resistance. So blood pressure is decreased. That's how it acts. Now next one is nothing but the adrenergic blockers. Adrenergic blockers. So in that you have alpha blockers and beta blockers. So alpha blockers. So non-selective alpha blockers like pentolamine, indoramine. These are known as a non-selective beta blockers. Non-selective beta blockers. So it has short duration of action and it is used in the diagnosis of pheochromocytoma. इसके ऊपर क्वेश्चन आ चुका है. Drug used in the diagnosis of pheochromocytoma. Pentolamine. फ्यूक्रोमोसाइटोमा क्या होता है? जो आपका प्रोस्टेट ग्लैंड होता है, प्रोस्टेट ग्लैंड, प्रोस्टेट ग्रंथि. So there is a cancer of prostate gland known as a pheochromocytoma or hyperplasia of prostate gland known as a pheochromocytoma. Now in this prostate gland there is a synthesis of adrenaline. There is a synthesis of adrenaline, and because of that adrenaline there is increase in the blood pressure. So in case of pheochromocytoma there is an increase in the blood pressure due to prostate hyperplasia. And now this drug is used in the diagnosis of that. It is nothing but the tumor of medulla which secrete the noradrenaline. What is it? Pheochromocytoma is nothing but the tumor of adrenal medulla which secrete the noradrenaline. So pentolamine, tolazoline, these are the two drugs. Pentolamine and tolazoline, they are the drug of choice in case of hypertensive emergencies. Hypertensive emergency. Now clonidine withdrawal and cheese reaction also. So remember this pentolamine, tolazoline, these are the drug of choice in the emergency, hypertensive emergencies. Okay? And also these are the drug of choice in case of clonidine withdrawal and cheese reaction. तो माओ इनहिबिटर आप लेंगे और उसके साथ में कोई चीज या फिर आप कोई टायरामाइन कंटेनिंग फूड कंज्यूम करोगे तो उसमें हाइपरटेंशन हो जाएगा. And in that condition, these are the drug of choice. Pentolamine and tolazoline. These are the two non-selective alpha blockers. ये बार बार मैं बोल रहा हूँ क्योंकि इसके ऊपर क्वेश्चन आ चुका है. So remember tolazoline and pentolamine. These are the two drug used as a drug of they are the drug of choice in case of emergency hypertension, clonidine withdrawal symptoms, and also used in the cheese reaction. Now next is the phenoxybenzamine. Next one is the phenoxybenzamine. Again, it is a non-selective alpha blocker, longer acting alpha blocker, and it is used to treat the pre-operative patient with pheochromocytoma. इसको pheochromocytoma है उसके hypertension के लिए ऑपरेशन के पहले इसको यूज करेंगे. Pre-operative preparation for the patient of pheochromocytoma. Next one is nothing but the selective alpha blockers. Selective alpha blockers means prazosin, terazosin, doxazosin, all the zosins. Now they are nothing but the quinazoline derivative. They are nothing but the quinazoline derivative. Peripheral vasodilator. They are known as a peripheral vasodilator because they will block the alpha 1 receptor in the blood vessels. तो ये अल्फा 1 रिसेप्टर जो है ब्लड वेसल में उसको ब्लॉक करते हैं. आपको पहले ही हो चुका है. व्हाट डू मीन बाय अल्फा 1, व्हाट डू मीन बाय अल्फा 2, बीटा 1, बीटा 2, बीटा 3. When we were discussing about the sympathetic nervous system and drug acting on sympathetic nervous system. So उस टाइम पे बोला है अल्फा 2 1 receptor is stimulatory, अल्फा 2 is inhibitory, बीटा 1 is stimulatory, बीटा 2 is inhibitory, बीटा 3 is also inhibitory. Alpha 1 receptor causes vasoconstriction, alpha 2 receptor causes vasodilation, beta 1 receptor causes increase in the heart rate and force of contraction. Beta 3 receptor is responsible for the lipolysis in the adipose tissue. It's a boli. So prazosin, terazosin, doxazosin, all these zosins are quinazoline derivative and they are known as a peripheral vasodilator. They block the alpha adrenergic receptor, alpha 1. It is inhibitive in the blocking the, these drugs are only effective in the blocking the alpha 1 receptor at the effector cell, not they are not able to block the alpha receptor which are pre-synaptic, and therefore they can cause a reflex tachycardia. It does not affect the renal function and cardiac output, and there is no action on renin angiotensin axis. They only block the alpha 1 receptor, decreases the peripheral resistance. Adverse drug reaction क्या है? So first dose hypotension, drowsiness, tiredness, weakness, nausea, diarrhea, fluid retention, palpitation, nervousness. Important adverse reaction is impaired ejaculation in the male. Alpha receptor blockers, selective alpha blockers का क्या है? क्या adverse effect है? Impaired ejaculation in men. So it will not, the men will not be, there will be impairment in the release of sperms. That is a ejaculation in the men. Okay. Now, what are the uses of these selective alpha 1 blockers? So they are used to treat the congestive cardiac failure again. Then benign prostate hyperplasia or hypertrophy. Benign prostate hypertrophy, that means prostate cancer with obstructive symptoms. So they are used in the benign prostate hyperplasia, benign prostate hypertrophy. Terazosin, doxazosin, alplozocin, tamsulosin, these are the drugs that is selective alpha 1 blocker. So out of that, terazosin, doxazosin, they are long acting and they are drug of choice in the scorpion sting. ठीक है, याद रखो यहाँ पे प्राजोसिन जो है इज अ ड्रग ऑफ चॉइस इन द स्कॉर्पियन टिंग. अगर आपको बिच्छू ने काट लिया तो उसमें ड्रग ऑफ चॉइस कौन सा है? स्कॉर्पियन टिंग. स्कॉर्पियन स्टिंग में ड्रग ऑफ चॉइस इन द स्कॉर्पियन स्टिंग. मुझे बिच्छू, जो बिच्छू होता है आपका स्कॉर्पियन, उसके बाइट करने के लिए ड्रग ऑफ चॉइस है उसके बाइट के बाद प्राजोसिन. प्राजोसिन इज अ ड्रग ऑफ चॉइस इन केस ऑफ स्कॉर्पियन स्टिंग. ये ठीक है, याद रखो. And these drugs are also used as a anti-hypertensive. Drugs are also used as a treatment of pheochromocytoma. That is a hypertension because of the pheochromocytoma or because of the benign prostate hypertrophy of your prostate gland. You can see over here again the mechanism of action of the same. This prazosin it will block the alpha 1 receptor in the blood vessels, particularly arterioles, and because of that it will cause vasodilation and will decrease the sympathetic outflow. Decrease the sympathetic outflow and will cause vasodilation and will decrease the peripheral resistance. And if peripheral resistance is decreased, that means blood pressure is also decreased. Next one is known as a beta blockers. Next one is known as a beta blockers. Beta blockers means beta adrenergic receptor blockers. So details of this beta blockers we have seen in the when we was discussing about the adrenolytics, sympathomimetic sympatholytics. So sympatholytic में आपने देखा है details regarding the beta blockers. Okay. Only antihypertensive effect of this beta blockers is due to the blocking of beta receptor in the heart. Lowering of they will block the beta receptor and that's why they will decrease the heart rate. They will decrease the force of contraction. So they will decrease the cardiac output as well as they will decrease the peripheral resistance. And also in case of chronic administration, they decreases the cardiac output and renin release. So renin release decrease करेगा, cardiac output decrease करेगा, peripheral resistance decrease करेगा. Beta blockers. Reduction in the BP in the hypertensive patient, both systolic and diastolic blood pressure is lowered. Okay. In the supine as well as standing position. जब आप सोते हो या फिर खड़े रहते हो उस दोनों पोजिशन में ये ब्लड प्रेशर कम करेगा. They do not cause tachycardia as caused by vasodilators. Sudden withdrawal of beta blockers can result in the dangerous tachycardia and rebound, increase in the blood pressure in the angina pectoris. Contraindication क्या है? It includes cardiac, pulmonary and peripheral vascular disease. तो जिसको cardiac muscle pulmonary, cardiac, pulmonary and peripheral vascular disease जिनको है उसमें beta blocker use नहीं करेंगे. All these beta blockers can result in the sodium and water retention and hence diuretics drugs are combined with the beta blockers because all beta blockers can increase the sodium and water retention. That's why you have to give these beta blockers with the diuretics. Okay, याद रखो ये beta blockers क्या करेंगे? Beta blockers क्या करेंगे? Because of the blockage of beta 1 receptor in the heart, they will decrease the cardiac output, they will decrease the heart rate, they will decrease the blood pressure, they will also decrease the renin release. Remember. Okay. Now we'll see the next one. We go mechanism of action of beta blockers. So actually the contribution for decrease in the blood pressure, it is because of the three reasons. Beta blockers, first beta blockers act on a heart. Because of the beta blocking activity, they decreases the heart rate and force of contraction, and therefore they decreases the cardiac output. Cardiac output come करेंगे by acting on a heart. Beta 1 receptor of heart, they will block the beta 1 receptor, and therefore they will decrease the heart rate, force of contraction, and cardiac output. That is the first. Second, they will act on a kidney. Because of the blockage of beta 1 receptor in the kidney, they decreases the renin release. And renin release, it is a decreased in the renin release, so renin will not convert angiotensin second, angiotensin again into angiotensin 1 and second. So angiotensin second production is decreased, and angiotensin second production is decreased. That means vasoconstriction is decreased. That means peripheral resistance is decreased. And again, this aldosterone secretion is also decreased because of the decreased production of angiotensin second. सोडियम वाटर रिटेंशन नहीं होगा, वॉल्यूम ब्लड का नहीं बढ़ेगा, कार्डियक आउटपुट क्या होगा, कम होगा. एंड आपको मालूम है कार्डियक आउटपुट एंड पेरिफेरल रेजिस्टेंस इज इक्वल टू ब्लड प्रेशर. अगेन ये ब्रेन में क्या करेंगे, ब्रेन में दे विल डिक्रीज द सिंपैथेटिक एक्टिविटी एंड कॉज vasodilation and decrease the peripheral resistance. And decrease the peripheral resistance, decrease the cardiac output means decreased in the blood pressure. Now next one is the vasodilators. They will dilate the blood vessels. Vasodilator means they will dilate the blood vessels. So if there is a dilation of blood vessels, that means there is a decreased peripheral resistance, and if decreased peripheral resistance is there, that means they will decrease the blood pressure. So in that you have different classes like arteriodilators, arteries dilators, or arteriovenodilators. First drug is hypertension. So it decreases the blood pressure by accompanied by decreasing the total peripheral resistance. So obviously ये blood pressure decrease कब क्यों करते हैं? Because of they decrease the peripheral resistance. And compensatory tachycardia, decrease in the stroke volume, cardiac output. They decrease the stroke volume and cardiac output also because they have vasodilating property. It can cause increase in the plasma renin activity and fluid retention. Adverse drug reaction क्या है? GIT, adverse effect like gastric, जैसे nausea, vomiting, diarrhea हो गए. Hyposecretion, gastric acid hyposecretion means achloride, decrease in the secretion of gastric acid, anorexia and diarrhea. Cardiac effects like palpitation, tachycardia, and anginal attack. Other adverse effects like headache, nasal congestion, flushing, and tremors, dizziness. Large doses and chronic use of this hypertension. If you use large dose and chronic use of hypertension, can lead to syndrome resembling to rheumatoid arthritis and disseminated lupus erythematosus. Now, hypertension is metabolized by acetylation reaction. Hypertension जो drug है, it is metabolized by acetylation reaction and its effect is genetically determined. जैसे slow acetylators होते हैं, rapid acetylators होते हैं, जो जैसे मैंने बोला है आपको general pharmacology. So okay, then it is used as a arteriolar dilator in the management of congestive cardiac failure. ये क्या है? ये सिर्फ arteries जो होता है उसको ही dilate करेगा. So it is used in the treatment of congestive heart failure as a arteriolar dilator. Actually, these vasodilators, they have limited application in the as an antihypertensive because they are advanced effect. Next one is a sodium nitroprusside. Now it is known as a atrio plus venodilator. सोडियम नाइट्रोप्रोसाइड क्या है? दोनों को डायलेट करता है, आर्टरीज को भी और वेन्स को भी. So it is used as a color indicator in case of color indicator for acetone and aldehyde. Sodium nitroprusside ये indicator बोल के भी यूज करते हैं. And it is also regarded as a poison क्योंकि ये सोडियम नाइट्रोप्रोसाइड क्या है? Poison भी है because in the sodium nitroprusside you have cyanide group. It can cause poisoning. Sodium nitroprusside. Now this drug is metabolized in the blood vessels and it will release nitric oxide. And this nitric oxide causes vasodilation because nitric oxide is a endothelium derived relaxing factor, EDRF. Nitric oxide is a EDRF, endothelium derived relaxing factor, so it causes vasodilation. So they release the nitric oxide and that's why causes vasodilation. So obviously that vasodilation result in the decreased in the peripheral resistance. जैसे blood vessel dilate हो जाएगा, peripheral resistance क्या होगा? Decrease हो जाएगा. So reduction in the peripheral resistance and venous tone reduces the afterload and preload. This sodium nitroprusside is used in the angina pectoris. Only freshly prepared solution is used. Only freshly prepared solution is used because it is a light sensitive and when exposed to light, drug gets converted into cyanide. मतलब ये सोडियम नाइट्रोक्लोराइड का सॉल्यूशन इमीडिएटली बनाना है और यूज करना है. अगर उसको बना के रखेंगे तो वो सोडियम नाइट्रोक्लोराइड बनेगा साइनाइड, वो पॉइजन बनेगा. एडवर्स रिएक्शन क्या है? एडवर्स रिएक्शन हाई डोज और रिनल high doses causes renal insufficiency, and it can precipitate the isothiocyanate toxicity, hepatic dysfunction, and may result because of the toxic cyanide ion. Now, sodium nitroprusside is a drug used in the emergency management of hypertension. It is also used to produce controlled hypertension during the surgery of myocardial infarction to improve the left ventricular failure. Also used in the angina pectoris. So these are the uses. तो मैकेनिज्म ऑफ एक्शन ऑफ सोडियम नाइट्रोक्साइड क्या करता है? याद रखो, सोडियम नाइट्रोक्साइड ओके, इट स्टिमुलेट द guanyl cyclase enzyme and stimulation of guanyl cyclase increases the intracellular cyclic GMP and increased cyclic GMP causes relaxation of vascular smooth muscle and because of the dilation of arteries and veins are there, which decreases the peripheral resistance, and that's why there is decrease in the blood pressure. So mechanism of action of sodium nitroxide याद रखो, and also due to release of nitric oxide. तो सोडियम नाइट्रोक्साइड क्या करता है? नाइट्रिक ऑक्साइड रिलीज करता है. नाइट्रिक ऑक्साइड क्या करेगा? इट विल स्टिमुलेट द guanyl cyclase, it will increase the cyclic GMP level in the cell, which causes relaxation of vascular smooth muscle, and that leads to dilation of blood vessel and decrease in the peripheral resistance and decrease in the blood pressure. Now next one is known as calcium channel blockers. Calcium channel blockers. We have already seen these calcium channel blockers in the person we will see in the anti-anginal drug. See, calcium channel blockers में आता है आपका verapamil, liltiazem, okay, and dihydropyrimidines like nifedipine, amlodipine, nicardipine, etc. So they are used in the long-term treatment of hypertension. Okay, they are used in the long-term treatment of hypertension. Nifedipine is used in the management of hypertensive emergencies. Dipines are known as a peripherally acting calcium channel blockers. Nimlodipine is a cerebroselective vasodilator and used to reverse the vasoconstriction after subarachnoid hemorrhage. ये निम्लोडिपिन जो है डिपिन्स का डायहाइड्रोपिरिमिडिन डेरिवेटिव जो है उसमें आपका निपेडिपिन आता है, ठीक है, निम्लोडिपिन आता है, नाइट्राडिपिन, बहुत सारे ड्रग है डिपिन्स पे. So out of that, nimlodipine is known as a cerebroselective vasodilator. मतलब ये cerebral blood vessel को dilate करेगा and it is used to reverse the vasoconstriction after the subarachnoid hemorrhage. मतलब जैसे आपके खोपड़ी में कुछ लगा है, जैसे आप गिर गए स्कूटी में से या फिर गाड़ी में से या फिर झगड़ा हुआ आपका किसी के साथ, अगर आपको ब्रेन हेमरेज हो गया, so due to bleeding inside the skull there is a vasoconstriction, and to counteract that this nimlodipine is used. Okay, then clevidipine is also one of the dihydropyrimidine derivative. Clevidipine is a short-acting dihydropyrimidine derivative recently approved for hypertensive emergencies. Next class is the potassium channel activators. Diazoxide, minoxidil, nicorandil, and pinacidil. Diazoxide, minoxidil, nicorandil, and pinacidil. These are the drugs combined with the ATP modulated potassium ion channel and opens it. By opening it, causes leakage of potassium outside the cell, and that leads to hyperpolarization of, and there is a relaxation of smooth muscle which causes relaxation of blood vessels. ये क्या करेंगे? ये पोटेशियम चैनल ओपनर से ये क्या करेंगे? पोटेशियम चैनल को ओपन कर देंगे. जो ब्लड वेसल में स्मूथ मसल है उसमें पोटेशियम चैनल होता है, वो पोटेशियम चैनल ऑलरेडी पोटेशियम इज नोन एज इंट्रासेलुलर कैटायन, ठीक है, सेल के अंदर रहता है, तो यहाँ से ओपन कर देंगे और सेल को बाहर लेके आएंगे. तो उसकी वजह से क्या होता है कि इनसाइड सेल पोटेंशियल जो रहता है बिकॉज ऑफ दैट पोटेशियम नेगेटिव रहता है, तो ऑलरेडी इनसाइड द सेल पोटेंशियल नेगेटिव है और ऊपर से पोटेशियम बाहर आ रहा है, तो वहाँ पे क्या होगा? हाइपरपोलराइजेशन होगा, दैट लीड्स टू vasodilation. Now minoxidil, it is used as an oral vasodilator. It is more potent and less toxic than diazoxide. Minoxidil is a prodrug. It is converted into minoxidil sulfate. Minoxidil sulfate is the active metabolite of minoxidil. ओके, याद रखो इसके बारे में। मिनोक्सिडिल इज ड्रग यूज्ड इन द ट्रीटमेंट ऑफ एलोपेसिया। एलोपेसिया मतलब क्या? बालनेस, जिसके सर के ऊपर बाल नहीं है उसको बोलेंगे एलोपेसिया। Minoxidil is used in the treatment of alopecia to promote the hair growth. So it is a hair growth promoter. Okay, promoter. It acts by increasing the microcirculation, direct stimulation of hair follicle, and alteration of androgenic effect. It can cause hirsutism in the female. Hirsutism मतलब male characters in the female. मेल कैरेक्टर क्या होता है फीमेल में? जैसे लड़कियों की दाढ़ी नहीं होती, लड़कियों की मूंछ नहीं होती, तो ये मिनोक्सिडिल अगर लेंगे तो लड़कियों में दाढ़ी वगैरह मूंछ वगैरह आ जाएंगी, उसको बोलते हैं हिर्सुटिज्म। If male characters are present in the female, that is known as a hirsutism, and if female characters are present in the male, that is known as a gynecomastia. याद रखो ये, it's not a joke, it's not a part of joke. Hirsutism means presence of male character in the female, and presence of female character in the male is known as a gynecomastia. जैसे नॉर्मल मेल्स में चेस्ट क्या होता है, थोड़ा उसका साइज कम होता है, गायनेकोमेस्टिया जिसका उसका चेस्ट बहुत ही बड़ा बन जाता है, लाइक लाइक वुमन, ओके, दैट्स नोन एज अ गायनेकोमेस्टिया। मिनोक्सिडिल इज अ ड्रग यूज्ड इन द ट्रीटमेंट ऑफ एलोपेसिया। यहाँ पे ये याद रखो, इट्स इंपॉर्टेंट है। इट एक्ट्स बाय इंक्रीजिंग द माइक्रो सर्कुलेशन, इट इंक्रीजेस द ब्लड फ्लो इन द हेयर फॉलिकल and stimulate the hair follicle, also alter the androgenic effect. So that's how minoxidil is used in the hair promoter. ये याद रखो। It is also a vasodilator. Hair promoter है मतलब उसका ये नहीं कि इसका blood pressure में भी यूज है, but mostly nowadays it is used in the treatment of baldness or alopecia. क्वेश्चन आ चुके हैं इसके ऊपर, बहुत बार क्वेश्चन कहाँ पे आए ये भी बोलता हूँ टाइम टू टाइम। Now calcium channel blockers, how they will act? Calcium channel blockers, so they binds with the L type of calcium channel present in the heart. जो हार्ट में आपका L टाइप ऑफ कैल्शियम चैनल प्रेजेंट होता है, मतलब आपने देखा है कि इलेक्ट्रोफिजियोलॉजी ऑफ हार्ट, जैसे सोडियम अंदर जाएगा तो कैल्शियम भी अंदर जाएगा। कैल्शियम अंदर क्यों जाता है? बिकॉज ऑफ द L टाइप ऑफ कैल्शियम चैनल होते हैं उसमें। So they will binds to L type of calcium channel in the heart muscle and vascular smooth muscle, blood vessel में भी smooth muscle है उसको bind करते हैं। They inhibit the passage of calcium through these channels and prevent the depolarization. Okay, and that's why they causes, what is the effect on vascular smooth muscle? They causes the relaxation of vascular smooth muscle, which leads to vasodilation and decrease in the peripheral resistance. On the heart, they causes negative inotropic effect and negative chronotropic effect. Means they will decrease the heart rate, they will decrease the force of contraction. That's why they will decrease the cardiac output. So if there is decrease in the cardiac output, there is decrease in the peripheral resistance, there is a decrease in the blood pressure. That's how calcium channel blockers will act. Next one is a angiotensin converting enzyme inhibitors, ACE inhibitors. इसमें क्या आता है? बहुत सारे ड्रग आते हैं, कैप्टोप्रिल, लिसिनोप्रिल, पेनिटोप्रिल, फोसिनोप्रिल, बहुत सारे ड्रग। So remember, out of that, कैप्टोप्रिल and लिसिनोप्रिल, they are not prodrugs. यहाँ पे ये क्वेश्चन आ चुका है, one of the following is not prodrug. इसमें सब एग्जांपल देंगे आपको ACE inhibitors के। So remember over here, captopril and lisinopril, they are not a prodrug, and other drugs are a product like inapril, ramipril, benzapril, fosinapril, quinapril, they are the prodrug. तो ये इनका एक्टिव मेटाबोलाइट कौन होगा? ठीक है, इनाप्रिल का एक्टिव मेटाबोलाइट होता है इनाप्रिलेट। एलेट ये जोड़ दो, इनाप्रिल के आगे एलेट ये जोड़ दो, इनाप्रिलेट, रैमिप्रिल के आगे एलेट ये जोड़ दो, रैमिप्रिलेट, बेंजाप्रिलेट, फोसिनोप्रिलेट। Prelates are the active metabolites of these drugs. Inapril का active metabolite होगा inaprilate. Okay. So remember captopril and lisinopril. These are not a prodrug, and other are the prodrugs. Okay. Now captopril क्या है? Captopril is a angiotensin converting enzyme inhibitor, orally used ACE inhibitor, and it is nothing but the D3 markapto 2 methylpropanoyl proline. So it is a proline derivative. यहाँ पे दो अमीनो एसिड होते हैं इसमें, इसके ऊपर भी क्वेश्चन आ चुका है, व्हाट आर द डिफरेंट अमीनो एसिड प्रेजेंट इन द कैप्टोप्रिल। तो प्रोलिन, प्रिल मतलब प्रोलिन, प्रिल फॉर प्रोलिन। अनदर अमीनो एसिड होता है एलानिन, एलानिन प्लस प्रोलिन। ओके, So captopril is made up of two amino acid alanine plus proline. Remember, यहाँ पे लिखा नहीं है कुछ, सब कुछ यहाँ पे लिख के ही बोलूंगा, फिर आपका क्या रोल है? You have to write something. So remember, it is a captopril is a ACE inhibitor, angiotensin converting enzyme inhibitor. क्या करेगा? angiotensin का रोल क्या है? angiotensin converting enzyme का रोल क्या है? It will convert angiotensin 1 to angiotensin 2. So therefore captopril competitively blocks the conversion of angiotensin 1 to angiotensin 2 and therefore prevent the vasopressor effect of the angiotensin second and also prevent the stimulation of aldosterone release. Now, angiotensin converting enzyme is not only responsible for the making of angiotensin 2 from angiotensin 1. So, angiotensin converting enzyme is also responsible for the metabolism of bradykinin and other peptides. Bradykinin and other peptides. Therefore, inhibition of angiotensin converting enzyme. Okay, so angiotensin converting enzyme क्या क्या काम करता है? दो काम करता है. पहला काम करता है angiotensin 1 को angiotensin second में बनाता है, which is a vasopressor, which increases the blood pressure. Therefore, angiotensin blockers are used to prevent the conversion of angiotensin 1 to angiotensin second. But एक दूसरा भी काम होता है angiotensin converting enzyme का, to metabolize the bradykinin and other inflammatory peptides. इसको इनहिबिट करेंगे तो इनका मेटाबॉलिज्म नहीं होगा ब्रैडिकाइनिन का. So that's why there is one adverse effect of ACE inhibitors. ACE inhibitors will cause dry cough because of the inhibition of metabolism of bradykinin. Bradykinin का मेटाबॉलिज्म नहीं होगा और bradykinin का लेवल बॉडी में बढ़ जाएगा. Okay, so ACE inhibitors will increase the level of bradykinin and substance P, which are a potent vasodilator and later also contribute to the cardioprotective effect of. Now, in the hypertensive subject, captopril decreases the blood pressure both systolic as well as diastolic, and several beneficial effects are there in case of congestive cardiac failure, and it also increases the exercise tolerance in the angina. Adverse reaction क्या है? Persistent dry cough. As it is दो तीन बार क्वेश्चन आ चुका है इसके ऊपर. ACE inhibitors will have adverse effect of persistent dry cough, and that is due to excessive increase in the level of bradykinin. तो ब्रैडिकाइनिन का मेटाबॉलिज्म करने वाला एंजाइम कौन है? तो इसको इनहिबिट करेंगे तो ब्रैडिकाइनिन का लेवल बढ़ जाएगा और ड्राइनेस, ड्राई कफ. दैट इज द एडवर्स इफेक्ट ऑफ योर एस इनहिबिटर्स. तो एस इनहिबिटर विल प्रोड्यूस ए ड्राई कफ. ओके, याद रखो इसको. अदर इफेक्ट्स, एडवर्स इफेक्ट लाइक स्किन रैश, प्रोटीन यूरिया, प्रेजेंस ऑफ protein in the urine, a granulocytosis, disturbance in the sense of taste, vitiligo, headache, GIT disturbances. These are the other effects. So drugs should be avoided in the pregnancy because it can cause fetal toxicity. ये pregnancy में नहीं देना. ACE inhibitors are not specific inhibitors to the enzyme, and therefore inhibition of this leads to adverse effect like dry, dry cough because inhibition of other ACE, inhibition of ACE leads to substrate increase in the substrate like ब्रैडिकाइनिन एंड सब्सटेंस बी एंड न्यूरोकाइनेज. तो इसका मतलब ये है हिंदी में कि आपका जो एस है एंजियोटेंसिन कन्वर्टिंग एंजाइम, इसके दो काम है. एक काम है आपका एंजियोटेंसिन 1 को एंजियोटेंसिन सेकंड बनाना, और एंजियोटेंसिन सेकंड क्या करता है? ब्लड प्रेशर इंक्रीज करता है. दूसरा काम है इसका कि जो ब्रैडिकाइनिन, सब्सटेंस बी, न्यूरोकाइनिन जो है उनका ब्रेक डाउन करना है, उनका मेटाबॉलिज्म करना है. तो अभी आप एस इनहिबिटर्स यूज कर रहे हैं क्योंकि आपको एंजियोटेंसिन सेकंड नहीं बनने देना है, क्योंकि वो हाइपरटेंशन करता है. तो उसको तो आप प्रिवेंट कर रहे हो, लेकिन साथ साथ में आपका साइड बाय साइड क्या हो रहा है कि इसका लेवल बढ़ जा रहा है, किसका? ब्रैडिकाइनिन का लेवल बढ़ जा रहा है. एंड बिकॉज ऑफ इंक्रीज द ब्रैडिकाइनिन, सब्सटेंस पी एंड न्यूरोकाइनिन, इट कॉजेस persistent dry cough. याद रखो. ओके, नाउ यू कैन सी ओवर हियर, आपके बॉडी में एक ग्लाइकोप्रोटीन होता है, उसको बोलते हैं एंजियोटेंसिनोजेन. एंजियोटेंसिनोजेन, वो एंजियोटेंसिनोजेन को कन्वर्ट करता है रेनिन. ये जो रेनिन है ये एंजियोटेंसिनोजेन को कन्वर्ट करता है एंजियोटेंसिन 1 में. एंजियोटेंसिनोजेन 1 इज कन्वर्टेड इनटू एंजियोटेंसिन 1 बाय रेनिन. और ये एंजियोटेंसिनोजेन 1 जो है दैट इज कन्वर्टेड इनटू एंजियोटेंसिन सेकंड बाय एस. एंजियोटेंसिन कन्वर्टिंग एंजाइम क्या करेगा? एंजियोटेंसिन 1 को 2 में करेगा, and this angiotensin second acts on its receptor known as the angiotensin 1 receptor. It causes vasoconstriction. It causes vasoconstriction and increases the peripheral resistance. Now, angiotensin 1 receptor also causes the release of aldosterone. Aldosterone leads to increase the salt and water retention and blood volume. ये हो गया normal process. Okay. Now, beta receptor stimulation, beta 1 receptor stimulation increases the renin release. So that's why beta blockers prevent the release of beta blockers क्या करेंगे रिलीज नहीं होने देंगे. कोई उसके बाद रेनिन के एंटागोनिस्ट जो है यूज रेनिन एंटागोनिस्ट. सो एलिकाइरिन, ओके, एलिस्काइरिन and remicarin. Aliskiren and remicarin, these are the two drugs known as the renin inhibitors. They will prevent the function of renin. They will block the function of renin and will be prevent formation of angiotensin 1. Okay. Now another. This inapril, lisinopril, fosinapril, captopril, they are known as ACE inhibitor. They are known as ACE inhibitor. They will inhibit this enzyme and will prevent the formation of angiotensin second from angiotensin 1. Now this ACE enzyme also causes the okay this then this angiotensin second is act on a different receptor. Now these drugs known as a losartan, valsartan, telmisartan, irbesartan, so they are known as angiotensin receptor blockers. They block the interaction of angiotensin second with the receptor, prevent the vasoconstriction, decreases the blood pressure. Now these drugs, spironolactone, ipralenol, these are known as aldosterone antagonists. They block the aldosterone and prevent the sodium and water retention and prevent the increasing the volume of blood. So they decreases the volume of blood. One spironolactone and iplerenone. They are known as aldosterone antagonists. Okay. Now again you can see over it. So ACE inhibitors mechanism of action. ACE inhibitors inhibit the angiotensin converting enzyme that is known as ACE, and inhibition of this enzyme result in the decrease the synthesis or no synthesis of angiotensin second. No synthesis of angiotensin second. Okay? And because of no synthesis, it will not cause vasodilation. It will not cause vasoconstriction, and that result in the vasodilation. Decreases the peripheral resistance. Then again, if there is no formation of angiotensin second, so there is a decrease in the sympathetic activity, decrease in the peripheral resistance. If no angiotensin formula, that decreases the noradrenaline release, cardiac output. If there is no angiotensin second is formed, so there is no stimulation of aldosterone and water and sodium retention, which also decreases the cardiac output. If there is no formation of this angiotensin second, there is a lack of nitric. If there is no angiotensin second formed, decreases the depogenic action, decreases the cardiac output. Decrease the cardiac output and decrease the peripheral resistance, decreases the blood pressure. That's how angiotensin receptor blocker acts by preventing the formation of angiotensin second. At one end, at another end, what happens? At another end, because of the angiotensin converting enzyme inhibition, so there is no degradation of kinins. There is no degradation of kinins. Kinins are the inflammatory mediators, and because of that, they causes vasodilation and again decrease in the peripheral resistance. But on the other hand, increased level of kinins, bradykinin, and all that causes dry cough, which is the adverse effect of ACE inhibitors. That's how ACE inhibitors will act as antihypertensive. Now, what are the uses of these ACE inhibitors? So they are used in the all grades of hypertension. They can be combined with the diuretics to reduce the dose and hyperkalemia. They have little tendency of weakness and sexual dysfunction. It is used in the chronic congestive cardiac, diabetic neuropathy and myocardial infarction. Next kind of drug are known as angiotensin receptor blocker. So these drugs they competitively block the angiotensin second receptor. First drug is the losartan. So it is a selective angiotensin receptor second blocker. Because of the specific inhibition, they have less side effect. They have less side effect than captopril and all. They can increase the bradycardia due to angiotensin receptor blocking. So they prevent basically the binding of angiotensin second टू इट्स रिसेप्टर। जैसे एंजियोटेंसिन सेकंड क्या करता है, उसके रिसेप्टर के साथ में बाइंडिंग होकर फिर वैसोकंस्ट्रिक्शन करता है, ब्लड प्रेशर इंक्रीज करता है। तो लोसर्टान, इज़ोसर्टान, टेलमिसर्टान, इप्रासर्टान वो क्या करते हैं, एंजियोटेंसिन रिसेप्टर को ब्लॉक करते हैं। दे प्रिवेंट द बाइंडिंग ऑफ एंजियोटेंसिन सेकंड विद देयर रिसेप्टर एंड कॉजेस, they will prevent the vasoconstriction and prevent the increase in the blood pressure. Adverse drug reaction क्या है? They can cause fetal toxicity. बच्चे में ये क्या करेंगे, टॉक्सिटी करेंगे. And they should not be used in the pregnancy. They are contraindicated in the renal stenosis. ये renal stenosis मतलब आपकी किडनी का कोई ब्लड वेसल ऑक्लूजन हो गया है, उसमें उसको बोलते हैं renal stenosis. Renal stenosis. Skin rashes, neuropsychiatric symptoms like insomnia, confusion, nightmares, agitation, depression. Salarsin is again another drug competitive antagonist to angiotensin second, as well as partial agonist. It can be used as a diagnostic agent. In other drug कौन से, valsartan, ibrasartan, iprosartan, candesartan, they are the analog of losartan. इसके जैसे ही उनका इफेक्ट है. Now diuretics. Diuretics में क्या आता है, thiazide diuretics, pure osmotic diuretics, then high sealing diuretic, loop diuretics. Thiazide diuretics, they are mostly used, they reduce the blood pressure by decreasing the volume of blood. Okay, mechanism like sodium depletion, okay, and which leads to reduction in the plasma volume and cardiac output. They may produce mild vasodilation by inhibiting the sodium entry into इसका adverse reaction क्या है. Details regarding diuretics we are going to see in the chapter diuretics. They produces the hypokalemia, decrease in the potassium level. Hyperuricemia, increase the uric acid. Hypoglycemia, moderate increase in the serum high density lipoprotein. They are most valuable and safe drug and highly cost effective drug as an anti-hypertensive drug. Thiazides are the first line drug in the hypertension. इसके ऊपर क्वेश्चन आ चुका है. Thiazide diuretics, they are the first line drug used in the hypertension. Indapamide, zipamide are the similar drug like chlorothiazide. They are thiazide diuretics. Drawbacks of thiazide diuretics are, as an antihypertensive agent, they produces hypokalemia, which can result in the muscle pain, fatigue, loss of energy. They can produce erectile dysfunction, carbohydrate intolerance, precipitation of diabetes. They can produce dyslipidemia, hyperuricemia, increased instant or sudden cardiac death. They can result. Loop diuretics, they are not recommended in the moderate hypertension. Potassium sparing diuretic can be used to treat or prevent the risk of hypokalemia with other diuretics. So diuretic का mechanism action देख लीजिए. What they do, they decreases the sodium retention in the water, sodium and water retention in the body, and that's why they decreases the fluid volume. They decreases the fluid volume. Blood का volume decrease हो गया तो cardiac output decrease होगा. And they also decreases the sodium retention in the body, calcium retention in the body, and therefore causes vascular relaxation and decreases the peripheral resistance. So decrease the peripheral resistance, decrease the cardiac output, leads to decrease in the blood pressure. Miscellaneous drug, उसमें miscellaneous drug आता है आपका एक मेटायरोसिन. It will block the synthesis of catecholamine by inhibiting the tyrosine hydroxylase. मेटायरोसिन जो है वो टायरोसिन हाइड्रोक्सिलेज एंजाइम जो है, सो टायरोसिन का कन्वर्जन होता है डोपामाइन डाइहाइड्रोक्सी phenylalanine by the enzyme tyrosine hydroxylase. Now, metyrosine block this step and prevent the synthesis of catecholamine. It is useful in the pre-operative treatment of the patient with pheochromocytoma. Adverse reaction क्या है? GIT symptoms, extrapyramidal effect, gastraluria, nasal congestion, gynecomastia, peripheral edema. It is not indicated in the essential hypertension. Now, drug therapy of hypertension in elderly patient. जो बूढ़े पेशेंट होते हैं उनमें क्या करेंगे? ठीक है, उनमें तो आप बीटा ब्लॉकर्स वगैरह यूज नहीं कर सकते. सो द बेस्ट ड्रग ऑफ चॉइस फॉर द ट्रीटमेंट ऑफ एल्डरली हाइपरटेंशन इज अ डायूरेटिक्स. डायूरेटिक्स दे दो उसको, ऑटोमेटिकली ब्लड वॉल्यूम कम हो जाएगा, ब्लड प्रेशर कम हो जाएगा. ड्रग थेरेपी ऑफ हाइपरटेंशन इन द प्रेगनेंसी. मिथाइल डोपा इज अ ड्रग ऑफ चॉइस एंड इट इज सेफ. ये कम से कम 3 बार बोला है. मिथाइल डोपा इज अ ड्रग ऑफ चॉइस इन द प्रेगनेंसी. इट इज सेफ फॉर ऑल मदर्स. It is safe for mother as well as baby. Clonidine and nifedipine can be used safely, but drug of choice is a methyldopa. Labetalol जो है, it is a hepatotoxic. जो labetalol मतलब beta blocker, non-selective beta blocker. ACE inhibitors can cause oligohydramnios. Oligohydramnios मतलब they can decrease the blood volume. ACE inhibitors can be absolutely contraindicated in the pregnancy. Pregnant woman में ACE inhibitor use नहीं करना है. Diuretics are not first line for the hypertension in the pregnancy. They can cause depletion of intravascular volume and neonatal thrombocytopenia. So diuretic they are the first line agent for the hypertension in the elderly people. अगर बूढ़े लोग होंगे तो उसमें डायरेटिक दे दो. प्रेग्नेंट वुमन है तो उसमें मिथाइल डोपाक्लोनिडीन वगैरह यूज करो. प्रेग्नेंट वुमन में एस इनहिबिटर्स यूज नहीं करना है, डायरेटिक भी यूज नहीं करना है. ठीक है. Now again there is one more drug known as magnesium sulfate. Magnesium sulfate, okay. Magnesium sulfate is a drug of choice for the prevention and treatment of eclamptic convulsions in the pregnancy. Eclamptic convulsion क्या होता है? ये होता है eclampsia. Eclampsia क्या होता है कि there is a increased blood pressure during pregnancy and that is known as a eclampsia. और उसकी वजह से क्या होता है कि epilepsy भी होता है pregnancy. So to control that, magnesium sulfate is a drug of choice. This was regarding the anti-hypertension.